Breast health is on the minds of many women across the country after hearing the stunning news last week that actress Angelina Jolie underwent a preventive double mastectomy and reconstructive surgery. And while the surgery may seem like an extreme precaution, it reminds us how important regular checkups and screenings are. Joining me now is Jean Capassi from Norwalk Hospital. Doctor, thank you so much for being here.
Thank you for having me.
So we talked a little bit about Angelina Jolie's case. She had a gene that said that she was going to be had an 87% chance of getting breast cancer. Talk to me a little bit about that genetic gene, the testing.
That's exactly right. So there are two genes that we know of. They're called BRCA1 and 2, and they actually account for a very small percentage of women who get breast cancer, probably only 5 to 10%. So less than 1% of American women are at risk for carrying those genes, but certainly women who have a strong family history should consider getting tested.
Okay. And are there any risks associated with getting testing? It's probably a simple process.
Yeah, the process is simple. You know, I think it's helpful to speak to a genetic counselor because you have to know what the consequences are of knowing that you have the gene. You have to be prepared to make some difficult decisions, as Angelina Jolie did. But the test itself is simply you swab your cheek, get some cells, it goes to a lab. There's only one lab in the country that does it, and you get the results.
Okay. So what are the first steps women should be taking in preventive care when it comes to breast health?
Yeah, so, you know, again, most women are not going to have a gene for breast cancer, but all women are at risk. And so it's really important for most women to just have their screenings. Starting at age 40, it's recommended that women have a yearly mammogram. And then, of course, women should keep an eye on their breast and see their doctors for a breast exam once a year.
Okay, and you say even if there's a negative result from the image, there still might be some concern.
Right. Well, if women have a concern, if they feel a lump or see a change in the skin of the breast or they see some discharge from the nipple, those are all things that should be evaluated even if they have negative imaging. And I've seen women who come to me and say, well, you know, I had a problem, but I had my screening mammogram and it was okay. If you don't tell the radiologist that there's something going on, they don't know what to look for. And so it's a much more accurate test to have these studies if you tell the radiologist, yes, I have a lump, and they can focus in on that area. It's very important.
So what would be the first step if you do have some sort of abnormality? Obviously call a doctor, I would assume?
Absolutely. So either your gynecologist or your primary care physician, call them first. They'll do an exam also and either reassure you, and then they'll order the appropriate testing, whether it's an ultrasound or a mammogram. It's also important to know that mammograms and ultrasounds don't show everything, and it's possible to have a breast cancer and for the mammogram and ultrasound to be normal. So if a woman feels a lump, even if the mammogram and ultrasound are normal, she should still go see a doctor, possibly even see a breast specialist, and make sure everything's okay.
Doctor, talk to me a little bit about the mammogram procedure. A lot of women don't do it because they say it's uncomfortable, it's embarrassing, but tell us really what's going on.
Well, it's a short test. It can be uncomfortable. The breast has to be squeezed, and that's what a lot of women are uncomfortable with. But the amount of time it's squeezed is very short, and it is very important to get a good squeeze. If you can flatten out the breast tissue, you can see more. It's a better study.
Okay, and tell me a little bit about Norwalk Hospital, if you will.
Okay. We have a great breast health center at Norwalk Hospital, the Smilo Family Breast Health Center, and we have people at every step of the way to help. We have navigators and breast health nurses, so if you just call and have a question, they can direct you. Do you need imaging? We have state-of-the-art imaging. We have genetic counselors for genetic testing. We have breast surgeons like myself, so if there is a problem. And then, of course, for women who are diagnosed with cancer, we have oncologists and radiation oncologists and the whole gamut of cancer treatment, too.
Very good. Well, doctor, let's put the information up on the screen. You can contact Norwalk Hospital, visit them online at norwalkhospital.org. It's all right there. Doctor, thank you so much for the information.
Thank you for having me.
All right, up next we are heading into the kitchen with Betty Ann Donegan and Stephanie Dietz. We have a fabulous dessert recipe coming up. We'll be right back.